In 1875, a bold vision took shape on Ward's Island. The Homeopathic Medical Society of New York successfully petitioned to create a municipal hospital dedicated to compassionate care. That day, Ward's Island Homeopathic Hospital opened its doors, marking the beginning of what would become Metropolitan Hospital. From the very start, this hospital forged a unique partnership with New York Medical College, a collaboration that has endured for 150 years, making it the oldest hospital medical school affiliation in the United States.
Metropolitan Hospital has always been more than a place to receive care. It's a living institution that grows with its community, constantly evolving while staying true to our mission, providing high-quality, compassionate care for all, no exceptions. Over the past 150 years, Metropolitan has evolved into a full-service 338-bed hospital with an associated ambulatory service line including primary and subspecialty care, behavioral health, rehabilitation medicine, and more. Each year, we serve over 350,000 outpatient visitors and more than 50,000 emergency patients. With our long-standing partnership with New York Medical College, we continue to advance medical education while delivering care tailored to the needs of our diverse community.
In 1889, amidst the rise of modern medicine, Metropolitan faced challenges but remained steadfast. The hospital opened its School of Nursing in 1892, meeting the urgent demand for skilled caregivers during a time of rapid urban growth. By 1894, Metropolitan had relocated to Roosevelt Island, settling into the historic grounds of a former asylum, while pioneering postgraduate medical education, laying the foundation for today's residency training programs.
Since joining New York Medical College in 2019, I've had the privilege of preserving Metropolitan's rich history, both of yesterday and the present. Preserving this history matters because it connects us to the people and moments that shaped our community's health, informs how we approach care today, and it inspires future generations of healthcare providers to carry forward Metropolitan's mission of clinical excellence.
Responding to public health crises, Metropolitan opened the city's first dedicated tuberculosis pavilion in 1902 and grew to become the largest general hospital in the country by 1907. During World War I, our faculty and staff served bravely overseas as Base Hospital No. 48, delivering frontline care. The hospital's move in 1955 to East Harlem brought it closer to the diverse community it serves, a neighborhood that has remained at its heart ever since.
Metropolitan Hospital is a place of healing and learning. Our programs, such as the Breast Cancer Center and the pioneering Pride Health Center, reflect our commitment to providing clinically advanced and inclusive care. We're not just treating illness, we're uplifting the whole person. When the COVID-19 pandemic hit, Metropolitan became a crucial part of New York City's coordinated healthcare response. We expanded from 1 ICU to 5, ensuring care for the surge of patients in need. 5 years after the pandemic began, I retired from my role as Chief Medical Officer, passing the baton to the hospital's first woman Chief Medical Officer, marking a new chapter of leadership and progress.
In 1979, when financial uncertainty threatened to close its doors, Metropolitan's community stood firm, saving the hospital. In the decades since, innovative programs like City Cave expanded healthcare access for thousands. Graduate medical education flourished with new surgical training programs, and the hospital embraced digital innovation, especially during the COVID-19 pandemic, to connect patients and families in the most challenging times.
I've been living in Spanish Harlem for over 78 years, and I've been coming to Metropolitan just as long. All of my children have been born here, and also 2 of my grandchildren have been born here. I delivered my first grandchild at home, and we took her straight to Metropolitan Hospital. And now my granddaughter is working at Metropolitan Hospital. My husband, for 62 years we were married. He loved it Metropolitan Hospital. He didn't like going to no other hospital. In fact, when he got cancer, that he was sick, that he was dying, they had put him in another hospital, and he fought to be brought to Metro because he wanted to be here, because he felt that nobody was going to take care of him like Metropolitan. Everything was so beautifully done. And then I saw the priest was there. You know, I've never seen that in a hospital where they have all that caring and taking, you know, the way they take care of people. I've been here all my life. I've had everything done to me. I mean, there is nothing that they haven't done to me. And never had a complaint. I never had a complaint with a nurse. I never had a complaint with a doctor. You know, the only time that I ever complained was that sometimes you have to wait a little too long. But then again, you know, there's a lot of people. You know, it's like everything else. You know, you got to be online.
Today, Metropolitan stands strong, protected by the Flood Wall Resiliency Project, ensuring safety amid growing climate challenges. It also ranks as #1 in New York State for health equity and inclusivity, advancing its mission to be the most trusted, inclusive, and innovative community hospital in New York City. Serving one of New York City's most diverse communities, Metropolitan remains a vital safety net hospital, open to all. Our services are expanding, our expertise growing, and our commitment deepening every day.
Powered by the collective commitment of our clinical teams, staff, community partners, and supporters, Metropolitan will keep innovating, healing, and leading, standing as a beacon of hope and health for generations to come.
There's no other hospital but Metropolitan Hospital. It's like a home.